Hi, I'm Dr. Brian Koffman, a retired family doctor and the co-founder, chief medical officer, and executive president of the nonprofit CLL Society. And I'm presenting some of the most important research that was presented and resulted in 2023. Next, I'm going to talk about a paper presented at ICML, the International Conference on Malignant Lymphoma, and it was on low COVID mortality and hospitalization rates in CLL, chronic lymphocytic leukemia, and monoclonal B-cell lymphocytosis, or MBL. Do repeat vaccinations and antiviral therapies help? The bottom line on this was really encouraging. The hospitalization rate was only 5.2% and mortality rate was only 1.3% in COVID-infected patients with chronic lymphocytic leukemia or monoclonal B-cell lymphocytosis, MBL, a CLL precursor. Both CLL and MBL are associated with decreased immunity and worse outcomes in infections. The research was presented by Dr. Shen from Sydney, Australia, that led a team presenting at ICML, the International Conference on Malignant Lymphoma, in 2023 in Lugano, Switzerland. In the way of background, as many of you recall, mortality in CLL was very high early in the pandemic waves, at up to 30 to 40%, and remained high at 10 to 15% during later waves. This study was interested in whether repeated vaccinations attempting to achieve higher titers of protective spike antibodies and the new antiviral therapies would lower COVID mortality and morbidity. What was the method and who were the participants? Anti-spike antibody response was measured following multiple COVID vaccine doses to assess the optimal individual responses. 184 patients, 150 with CLL and 34 with MBL were studied. What were the results? 77 CLL patients, or 51.3%, and 18 MBL patients, 52.9%, had confirmed COVID infections. 4 had a second infection. There were 4, or 5.2%, of the CLL patients hospitalized, and the duration in hospital ranged from 3 to 8 weeks. But no patients required ventilation, but there was 1 death to acute renal failure at 4 weeks. No MBL patients, the CLL precursor, were hospitalized or died. Of the 67 CLL patients and MBL patients who were infected, for whom we have data, 21 received no medications and 20 had symptomatic relief only, while 35 of 67, 52.2%, received antiviral therapy. 15 received molnupiravir, 15 received Paxlovid, and 5 received remdesivir. So please note that only 20 of the 67 patients received either of the most effective antiviral COVID therapies, Paxlovid or remdesivir. Only 6 received prophylactic monoclonal antibodies prior to COVID infection. There were 89 out of 98 patients with positive anti-spike data. The anti-spike data in patients prior to infection were significantly lower in those who got infected compared to those who never got infected. So this suggests that higher antibody responses to vaccine did much better, and it's not just a positive or negative effect, it's a high titer that provides protection, and getting multiple boostings may improve that titer. So in conclusion, the overall hospitalization rate of 5.2% and the mortality rate of 1.3% in the COVID-infected CLL and MBL cohorts, while still too high, is very encouraging compared to the early pandemic results, especially knowing that only 20 of the 67 infected patients received what would now be considered optimal antiviral therapy, and only 6 received effective preventive antibodies. The protective benefit of higher antibodies after multiple vaccinations was also encouraging, but begs the question as how to protect the many who do not respond to the vaccine. Also unanswered is the questions about are these improved outcomes due to a milder strain of circulating SARS-CoV virus, such as Omicron? The authors didn't address that issue. They also didn't include the date range of the data collection. On the website, we give a link to the actual ICML abstract titled Repeated Vaccinations to Maximum Antibody Response in Antiviral Therapy in CLL and MBL Results in Very Low COVID Mortality and Hospitalizations Rates. We also include a link that provides more information and more details on the same research. Repeated COVID-19 vaccinations to maximum antibody response reveals very low mortality and hospitalization rates in patients with CLL and MBL. Thanks for listening. Stay strong. We are all in this together.